Nee, het is de... Oh, ga je het doen? Ah ja, hier. Wacht.
Nee, waar? Maar dat is wel meer op het gezicht, hè?
Ja, het is meer op het gezicht, hè.
Oké, zet al de rest uit en ik ga zeggen als we die net uitgetrokken.
Voor mij een rechtse. Oh, wel, die rechtse helemaal rechts is aan, ja.
Wacht, hè. Al ik even uitzetten.
Je hebt nu geen enkele van die twee. Wacht, hè. Oh, nee. Die moet aan. Wacht, hè. Nee, die moet aan. Ah, nee, wacht. Nee, als deze had je nu aan hebt gedaan.
Oké, die mag uit.
Ja.
En deze?
Nee.
Doet dat iets?
Nee.
Deze?
Ja, die is helemaal links daar. Dat is helemaal links. Probeer het helemaal rechts.
Staat die dan nog niet aan?
Nee.
Die rechtse.
Nee.
Pak dan weg, niet of
Nee, die werkt niet. Ik weet niet. Moet ik die sticker insteken? On peut changer la couleur, hein, c'est bon? Là-dessous. Merci beaucoup. C'est bon. Een beetje minder hard. Zo is goed. Zo is goed. Nee, nee, zo is goed, zo is goed, zo is goed. Oh merde, dit is een micro. Nee, hij zei niet meer aanraken.
Gentlemen, we're about ready to get started, so may I ask you to take your seats, please? Okay. There are still a few people arriving from the outside, but because we have such an interesting program for today, I think we should get started. So, ladies and gentlemen, dames en heren, mesdames et messieurs, welcome to this high-level conference on the future EU Health Union, convened by the Belgian presidency of the Council of Ministers of the European Union. We'll be hearing shortly from the host of the event, Minister Frank van den Broeke. But my name is Nick Fahy. I will be moderating these plenary sessions, drawing on my experience leading a research group on health and well-being for a non-profit research organization around Europe, as well as advising the European Observatory on Health Systems and Policies, hosted by the WHO, and wider activities within Europe. Colleagues, during COVID, we all saw the need for both solidarity and science in our communities, in our countries, and at the level of the European Union. Through research, we gathered knowledge about how to deal with the crisis. Through science, we managed to develop a vaccine at record speed. We also saw the potential for the European Union to contribute to solidarity in health, as the EU brought to bear a much wider range of tools in support of our collective health. And this expression of both solidarity and science in health, and the EU's contribution to it, have become grouped together under the label of a European Health Union, with the strengthening of our collective preparedness and more European funds for health than we've ever seen previously. But as everyone in this room will be well aware, there are still many challenges facing European health systems. So over these next 2 days, we will consider what should be the priorities of the next Commission and the next Parliament in addressing those challenges. And we will do so under the 3 themes of the Belgian presidency: care, preparedness, and protection. When we talk about care, we mean a Europe that cares for its people, whether through making sure that people can live a healthy life and addressing the challenges of the health workforce themselves, or making sure that we have the medical solutions that we really need. When we talk about prepares, we talk about a Europe that prepares for future health crises. While steps such as the creation of HERA have strengthened our collective preparedness, there are still many challenges of both content and structure in being able to respond to future threats, or indeed the very current threat of antimicrobial resistance, what some have described as a slow-motion pandemic. And when we talk about protecting, a Europe that protects its citizens against medicine shortages, the EU has announced major steps in recent months to safeguard the supply and production of critical medicines, and those will be further strengthened and implemented under the presidency. We will hear more about each of these themes from our 3 keynote speakers this morning, one for each of these different themes, and you will all have the opportunity to engage directly with these themes at the workshops that will take place this afternoon and tomorrow morning. If you are seeking inspiration and insight already in relation to these themes. There is greater exploration in the January edition of EuroHealth, which was produced by the European Observatory in collaboration with the Belgian presidency. And you can find a copy of that special EuroHealth edition in the tote bag you received when you came in. And if you want more, then you can download additional copies from the Observatory's website. But when we talk about these different challenges underpinning these different topics is a set of common values and principles that have always underpinned European health systems and that were articulated in the Council conclusions of 2006. Universality, access to good quality care, equity, and solidarity. Yet, as the scale and character of challenges facing our systems changes, our responses based on the same values still need to evolve and adapt. And exploring what that should mean in the coming years is the focus of these 2 days. Now, before we grapple with these challenges of substance, I have some housekeeping information which I should provide you. In, again, the tote bag that you received when you came in, you will find a folder which includes a document with practical information about the conference. That includes a table that tells you where each of the workshops this afternoon and tomorrow morning will take place. That will be either here or in room 120. To go to the other room, follow the signs to auditorium 120. And you will also find a copy of the program together with the session notes for each of the workshops. If you are in need of medical assistance, and notwithstanding the number of medical professionals already in this room, there is a first aid station located in the welcome area. And this is a discussion that takes place here, but it's a discussion which is relevant for people all across Europe. And so we encourage you to communicate about the event. Please don't hesitate to share your experiences. Feel free to post pictures of the venue on your social networks. You can use the hashtags EU2024BE and ConfHealthUnion24. A slight nuance with that, feel very free to communicate about the plenary sessions, both of which are also going to be live streamed. And will be covered by members of the press, and a warm welcome to the members of the press who are here today. The workshops, on the other hand, are not going to be live streamed and will be conducted under the Chatham House rule. The Chatham House rule means that you are free to use the information that is received in the workshop, but not to disclose the identity of any speakers or any of the other participants. In other words, you can tell people what you found out, but you can't tell them who said it. Please take that information into account when communicating about the workshops. The presidency will be communicating about the workshops, but respecting that same Chatham House rule. That, I think, is enough for all the housekeeping at this point. So, in that case, I would like to welcome to the stand some very important contributors. First and foremost, Minister van den Broeke, Deputy Prime Minister and Minister of Social Affairs and Public Health in Belgium, and a minister with very long experience now of these issues, including the discussions that led to those council conclusions in 2006, as well as all the experience of managing the COVID crisis. But for all that we have today, a set of inspiring leaders and contributors in today's world, we also want to hear from the future leaders and from the representatives of the young people who are going to be living in the health world that we create through the actions that we discuss at this conference. And to that, we will also invite for this first session 2 youth representatives, Beatrice Ciobanu and Laura Vestrata, who are representatives of the youth councils in the Dutch and French-speaking parts of Belgium. And I'd like to invite the 3 of you to come up now. Please join me in welcoming them to the stage. So thank you very much for joining us today, Minister, and Beatrice and Laura. We wanted to bring a youth perspective, Minister. I know this was part of your ambition, and you today are bringing your own perspective, but also the perspectives of the youth councils that you are both part of, and I know that you've conducted surveys that have informed the positions and the concerns that you are going to be describing today, as well as drawing on your own experience, Beatrice, your background in communication sciences and international relations, which seems very appropriate for today. And Laura, you're studying law, which also is a key relevance for today. And so I think in a few minutes we'd be very interested to hear your perspective about the challenges that we face. But Minister, also as the host and the Minister in office and the chair of the Health Council under the presidency, can I start by turning to you? What do you see as the key health challenges that we face at the moment when looking at it from your perspective?
Yeah, thank you for your generous introduction. I would like to focus on what the EU should do, and that's already a pretty long list. First of all, and very obviously, shortages of medicines, something with which patients, pharmacists, doctors live, and which is very, very nerve-wracking sometimes. That is a global issue. It's about global supply chain of medicines. So it is a European issue par excellence. So I would say first of the list, when we think about the EU's role, shortage of medicines. However, second on the list and immediately is prevention. Prevention is very much about consumption. Consumption is about what is on the market. When you say market, you say EU. And so the role of the EU in creating an environment, a market, first of all, that promotes a healthy lifestyle is key. And I think it is underrated, and I should say, it might come back later, that I'm really waiting for more initiative here with regard to tobacco, alcohol, stuff that is on the internal market. It's an internal market competence. Three, I would say that the EU obviously has a very important role in research and in steering research. And then the question is, are we guiding research efforts towards the most pressing societal and individual health needs? That's an important question. But then I also think about something that is also a very important challenge for any policymaker and for all people working in the health and healthcare domain, which is staff, healthcare workforce shortages. You might say this is very much competence of national member states. Partly true. There is also a very important EU dimension to this. And I would also add mental health and mental health care. This is very much national competence. However, I think the European Commissioner, Stella Kyriakides, has taken an outstanding initiative in putting that also on the EU agenda, because I think we can learn a lot from each other in how we address the mental health challenge. So I could dwell on, I won't do that, but so it's a pretty long list, and I think we tend to underrate the role the EU can play and therefore should play.
Thank you. And that's, you've rightly identified a set of really strong challenges at the European level. I'm curious to know how that relates to the challenges that you've heard and that you see amongst young people.
Yes, thank you, Nick. Thank you, Minister, and hello, everyone. So, as you said, Nick, we are representatives of young people at the EU level. So we are here to represent voices of young people from Belgium. And we conduct surveys on different topics, and we have conducted surveys on health as it became a central topic, especially after the pandemic. And the COVID crisis experience not only had an impact on young people's mental health, which is for us a central topic, and it is very our concern, but it also revealed some lacks in our health systems all over Europe, but also here in Belgium. And I'll let Laura speak about the lacks it revealed here.
Yes, what we saw during our surveys was that the biggest lack that young people really notice in their day lives is access to healthcare. And here I'm not only talking about financial access to healthcare and the health system, but also about the lack of healthcare forces. When we talk at events we organize, both where there are young people from Belgium and also other young people from Europe, they often mention medical deserts, places where they live in rural areas most of the time, and then they don't have access to medicines, to gynecologists, to psychologists, to general practitioners, etc. And this aspect of access to healthcare is very important to young people, also combined with the financial aspect, because you notice, or young people say that when they cannot go to, or they cannot receive the healthcare they need, it's much more difficult for them to hang out with their friends, to go to school as other young people do. And this has a really big impact on the lives of young people and also on their possibilities to develop themselves in society.
So, from our point of view, the question would be, can the EU provide meaningful solutions to these problems or to some of them?
Yes, so can the EU provide meaningful solutions to the problems of access, or access also to mental health care? The answer is yes. First of all, there is a very fundamental principle which has been agreed upon a number of years ago in 2017 in the context of what we call the European Pillar of Social Rights. This is 20 nice principles. The principle number 16 that has been very, very formally agreed upon says everyone, every European should have timely access to affordable, high-quality health care. And I think all those words are important. It's timely access, what you say. You should not be confronted with shortages that mean that you have to wait a very long time. You should not be confronted with shortages in certain regions. So timely access, affordable, which is about price, and high quality. That's principle number 16 of the Pillar of Social Rights. And I think in that way the EU sets a strategic direction, and in a sense that it links up with what I think Nick already mentions. These are the 2006 principles on values in healthcare, so there's a kind of a link between that. So it's important that that strategic orientation has been set. However, I should also add that thus far we did not develop that. The other principles of the pillar, so there are 19 other principles, some of the other principles have been really taken at heart, so there's been action about it and initiatives at EU level. Here I think we need more initiative. I'd also like to say that it's one thing to set a strategic direction, as the EU has done with this principle number 16. It's very nice. Huh? It's another thing to really enable member states to do that and to support them in doing that. To use a slightly brutal expression, the EU should make it possible that we put our money where our mouth is. And so there's a very big debate, obviously, underlying all this about fiscal policy, budgetary policy. My argument in the broader EU debate is that if you invest well in mental health, if you invest well in healthcare in general, there is a return to this. It's not just a cost factor, and that should be taken on board when we discuss our fiscal and budgetary policies. But more concretely, I think, when it comes to financial access, when it comes to timely access, when it comes to healthcare work, the health workforce, we can, first of all, learn a lot from each other. And that's one of the big added values, I would say, in the initiative taken by the Commission on Mental Health and Mental Health Care. So you create a discussion where you can learn from each other, because I think in many member states we struggle with how to organize primary mental health care. We are very committed to that. We invested a lot of money in a new provision of primary mental health care, which is also cheap, even for young people, free at the point of delivery, which I think is important. I think it's even just more than learning from each other. I think the EU should also, for instance, with regard to the health workforce, create a framework in its own competencies that gives us more leeway to improve the organization of the workforce, to have a more rich and, in a sense, a more flexible organization of that workforce.
Minister, one of the issues or the ideas you mentioned there is investing and you know, putting that money in. And one of the areas that's always talked about with that is prevention. Mm-hmm. We always know that prevention's one of the areas where we would get a return, and yet it's so hard to find the resources for that. Is that a topic that's come across in terms of the kinds of things that you've explored?
Yes, I think prevention is very important for young people, and also, or more specifically, for young people, it's very important to live healthy lifestyles, to know what healthy food options we have. And here, one of the things we miss most is the information about how can we live a healthy life while not having enough money to pay for things. The information about how to buy cheaper foods that is still healthy is missing. How to do sports with friends while not having the money to go to dancing classes, for example. So this whole aspect of prevention and the information aspect is very important to young people. And for example, one of the things we do notice is that, like peers of us, we use food apps in supermarkets to scan the barcode and then see how healthy the food is. So I think that's something, yeah, we do quite often. That is a good practice, but still that's not enough, and it's only about food. Healthy lifestyles is about much more than just food.
Also, when it comes to tobacco and alcohol, for example, the prevention, we feel worked very well on some young people. Like we have echoes, more and more young people are not consuming excessively or not consuming at all tobacco and alcohol, but still, those that are consuming it excessively sometimes are doing it for mental health reasons, or because there are problems and issues deeper than like the willingness of consuming excessively. They are consuming excessively to sometimes this consumption is a coping measure to escape reality, to avoid the problems, and it's a vicious cycle. So yeah, and also this industry that is lobbying a lot of products that exist, but also new products like vaping. We have teenagers in schools that tells us that they see other teenagers smoke inside the school system. So it's in France, I know they prohibited this vaping, limited vaping stuffs. But yeah, these are new problems that emerge because of the industry. So I feel like prevention works, but maybe it has to go deeper.
Yeah, that's a lot to be discussed. First of all, I didn't know about food apps with which you go in the supermarket. I'm slightly older than you are, so I didn't know. That's very interesting. I tend to try to look at the Nutri-Score if it is there, and then resist any temptation. But I didn't know that. That's interesting. But let me maybe immediately follow up on what Beatrice said. I think it's one thing to say to people, think about your food, think about your lifestyle, and we have to say that. But it's another thing to make that possible for everyone. And so I think the real challenge is to create an environment that empowers people and empowers all people to have a healthy lifestyle. And this is about health literacy, it's about understanding what's going on in debates about healthy lifestyle. And it's really about environment. Let me give an example. In the municipality where I live, Tervuren, we are confronted with a project by McDonald's to locate a new McDonald's very close to 2 schools. They know why they want to do that. It's obvious why they want to do that. We should resist it, but we don't have the instruments to resist it. This is all about environment. You have an industry, and certainly when you talk about tobacco and alcohol, you have an industry which business model is to exploit our human weakness. That's its business model. The business model is to make us addicted. And I think what is still insufficiently understood, also in the economic analysis, is that that business model has a very unequal impact in our society. Because it's easier to overcome some of your weaknesses when you are well informed, when you have a certain level of education, or let's say a level of understanding, when you have time, when you're not continuously under stress, when you have money. It's much easier to overcome this. And so that business, the tobacco industry, the alcohol industry, the betting industry, the way they exploit our human weakness has a detrimental societal impact, notably on those segments in the population which are less educated, have less money, live less well, and that's already 2 reasons why we should fight them. I would like to say to the tobacco industry, guys, you have no future. There is no future for you, stop it. Think about something else. And not about vaping, eh? Something totally different. Because the drama with that industry is that when they finally in a situation that it's impossible to continue their business model in one domain, their business model of making people addicted, they shift to another where they can apply that business model of making people addicted. That's one of the reasons why we decided in this country to ban from the market disposable vapes, which will be done by the 1st of January. It's just you have to get that off the market because it's a business model you don't want to flourish. Now, coming back then to the more practical questions, indeed, I think it's about labeling, it's about information. There will be a workshop in this conference on the initiatives and experience with labeling of alcoholic beverages, what is in it, and there I think that important initiatives have been announced by the EU about labeling alcoholic beverages, indicating the nutritional ingredients and let's say nutritional value. We're waiting for that. As much as we're waiting for an update of the directive on smoke-free environments. As I said, the EU is essentially about a market. But the market is of the essence when we want to create a healthy environment. And so it's really, this should be a wake-up call for the EU. It's their moral duty, given the essence of their competencies, to work on this.
Agreed.
So so that resonated. One of the other challenges, so this has been a very sort of long-term challenge, this permanent tension between health issues and markets, even if there are now some new tools which are being used in innovative ways. But a very time-specific challenge was the crisis and lockdown and COVID and what that experience was. I know from my own experience, I don't think any of us enjoyed lockdowns, but you could see clearly it had a particular impact on young people. What's your perspective on that? What was your experience?
Yes. Well, lockdown weighed heavy on young people. We felt that we didn't really live these 2 years, or that we didn't make the most out of it, that our lives have been paused. Yeah, for some of us, a lot of crises are coming all at once, and it reveals a lot of problems, also external ones, like we have the medicine shortages, the lack of the medical working staff that is migrating or going in other countries in Europe, etc. But we also have this dependence on China for masks, for medical tools, and we really saw that dependence with the COVID crisis experience. Also, I know that Laura wanted to add more crisis.
Yes, maybe coming back to the lockdown, I think, as Beatrice said, we indeed had the feeling that our lives were paused for 2 years and that we weren't able to grow as individuals and as a group. And here, I think it's important to also mention that a lot of the problems and the issues that came up during the pandemic and after the pandemic already existed before. But it is because of the pandemic that they were visible and that there was attention drawn to it. And also, the lockdown was weighted heavily on young people, also, like mentally, and we have a lot of other crises today, for example, conflicts around Europe, or the climate crisis, the cost of living crisis, etc. And all those crises impact young people, not only in their lives and in their day-to-day lives, but also mentally. And after the COVID pandemic, you saw that everyone wanted to change something and wanted to improve things. And so there was a lot of enthusiasm about that and a lot of willingness. But we are now 2 years further, and we see that that enthusiasm has tempered. We see that some initiatives are taken, but we, as young people, we still don't have the feeling that we, as Europe and as the EU, are prepared for a next crisis. Young people, they come on the streets, they protest, they use their social media to be vocal about crises that are happening right now, but we cannot take the real decisions. So we are looking at that at the policymakers and at the decision makers. So my question towards you, Minister, is more, do you think Europe is prepared for a next crisis? And if yes or if no, why? And what can we do to be prepared for a next one? Because there will come other ones.
Yeah, let me first of all say that I'm very much aware that this period with the lockdowns was extremely difficult for young people, I should say. When I remember the summer of 1973, when I left secondary school and prepared for university, we had 3 months of total freedom, of exploring everything, traveling, meeting. It was complete freedom. This was enormous. And obviously we made that impossible for young people. I think we should be very much aware of that and not forget about it. I think it is largely unavoidable, not to say that when we look back on the first measures taken, I think we should not have totally closed down schools. There is a difference between totally closing down a school system and having some teaching at a distance. And so this was not well understood. But okay, that's for the way we did it. But then the question is, have we now been really implementing what we should have learned? The answer is yes and no. I think it's fair to say that we, both at the national, also at the Flemish regional, at the EU level, we are better prepared. I think we are better prepared. But we are not sufficiently prepared. And one of the different things that worry me, first of all, at EU level, Ursula von der Leyen and the Commission have taken excellent initiatives, such as the creation of a health emergency response authority here. They have also invested a lot. We had this excellent idea of the joint procurement of vaccines. This was excellent. This was real solidarity. However, the result of all that, good initiatives, well-intended initiatives, is a landscape that in a sense is pretty messy. And the division of tasks is now not very clear, I should say. This is not it's not an easy criticism, it's not even a criticism. That's a result of a hectic process. But I think we have now to review that landscape and see to it that when the next crisis will hit, and it will certainly hit, the only question is when, but it will certainly hit. When the next crisis hits, it should be clear who is responsible for what. And also, how will we better coordinate our efforts? Because I think, as you kind of also indicated, it's even more difficult to say to young people in Belgium, you're not allowed to go to a pub. Whilst in the Netherlands, you can go to a pub. Or to say in one country, this vaccine will not be used for young people, whilst in another country, they say it will only be used for the younger people. So you need kind of better coordination, both on how you apply your measures, both your pharmaceutical and non-pharmaceutical measures, in order to sustain, let's say, support from the population. And certainly young people, they travel, they look around, they know more than one language, so they listen to what's happening in other countries. And so I think we need much closer coordination, but in order to have good coordination, we should have lean institutions, and there's a bit of a worry. So that's one of the reasons why we commissioned with the Belgian government, for the Belgian president, we commissioned an assessment on how these new institutions that should cater for preparedness function, the division of the work, the way they will communicate, and it signals that improvement is necessary. So in short, my answer is, yes, we are better prepared, but not sufficiently so.
And do you think you will be sufficiently prepared, or do you think there is willingness to be sufficiently prepared?
Look, I'm not a political scientist who looks at this from a distance like you look at water that is boiling and you say, when will it boil? I'm in the kettle. Is there sufficient willingness? I have to put up a fight quasi every day. But I will continue doing that. We have a difficult discussion. Pedro Facon is here and who was very active with me on the quality of internal air in closed spaces. We absolutely know how crucial it is to ventilate, to have fresh air, not to breathe second-hand air. Okay, we know this. Yet the resistance I have in organizing a true internal air quality policy is enormous. It is so short-sighted, so short-sighted. So we have to fight this tendency to regress to short-sightedness. But I'm not, I cannot be pessimistic about that. I'm a politician, I should fight.
So if the minister is optimistic, how optimistic do you feel, Laura and Beatrice, about this? Is this still a very present challenge, do you think? Is it something that motivates young people to get involved in these kinds of issues? What's your impression?
I think, first of all, we have to stay optimistic and we have to keep believing in it. I think in general, health and healthcare is something that really very much lives among young people as it impacts, as we already mentioned, our daily lives. And without good healthcare and all the issues we talked about, we cannot develop ourselves in the way we should be able to. And apart from that, on a personal level, I meet a lot of young people in just during conferences, during events, when I talk to people, and I'm always impressed about how much knowledge that those other young people have, and how much willingness they have to make some changes in the world and to to improve certain things. So if I look at them, then yes, I stay very optimistic, and I believe that we can like tackle the challenges and improve the issues we talked about.
Yes, and to de-zoom it and make it a bigger picture, I think we are not living in such a bad health system after all. Good things are here, good things are done. It's just that we should make some improvements sometimes, and sometimes see and admit that some things aren't working, or that there are some issues, and point them and make them a priority. And if we should conclude and say our priorities as young people, first of all, is to deconstruct the stereotypes and the taboo around mental health. A young boy told me that he wants to see mental health problems as flu, for example, because and we feel like the taboo is put most by older people, adults after 30. They are putting the taboo and make young people less willing to express their mental health problems, and also improving the material and human resources in our health system. That is, I think, always have been a priority. But yeah, we are keeping hope, and we are being optimistic, of course.
And what about your priorities, Laura? So,
I think first of all, what I mentioned before, the access to mental health and to healthcare, and this is linked with medicine shortages, with workforce shortages, with financial barriers, with waiting times, etc., just with almost everything. And then apart from that, also the prevention aspect. We need to prevent or have a good prevention policy when the next crisis hits, because when we focus on the prevention, it's also, we won't have as much issues to deal with when the crisis really hits, because we will be stronger as a group of people. So I would say those are my two priorities.
Minister, you have priorities and interests, but also optimism and a power for change from the young people. How does the presidency respond to this, do you think?
Let me first of all thank Laura and Beatrice for what they said. My own experience is that every new generation comes with new wisdom, with new insights. And it's also very operational. So we've been working together with a group of young people who had suffered from cancer at a young age. And so we developed part of our national cancer strategy, notably geared to young adults and adolescents, together with them on the basis of their insight. And this was extremely, extremely useful. And so, for instance, one of, I think, the new wisdom that comes with this new generation is that mental issues should not be kind of put aside. We should talk about them. We can need support from peers. Sometimes you need professional support, and that should be readily available if you need it. And I'm very grateful for the fact that young people make it possible to talk about that. When I was that much younger, in the summer of '73, we did not talk about that, not at all. And so that's very good, I think. And our policy should respond to that, to get away from the stigma and the taboo. Now, then coming to what this means in terms of our presidency program, I think, Nick, you already mentioned it in your introduction. We are working around 3 buzzwords. We have a kind of a banner saying we want a Europe that cares, a Europe that prepares, and a Europe that protects. Care is about the health workforce, how to address shortages. But it is also about prevention. It's about the follow-up to the EU Beating Cancer Plan, which was an excellent initiative. But as we said, in terms of prevention, and there is some delay in some initiatives, so we should speed it up. This is also about priorities in research and development and how to define the real priority unmet medical needs. Then we have this buzzword, a Europe that prepares. This is all about the preparedness, which Laura and Beatrice have also been underscoring. And then finally, a Europe that protects is about the security you need. You must be able to assure people, first of all, that medicines will be there when they go to the pharmacists. And so we have a very important agenda on tackling medicine shortages. It's a very ambitious agenda. Will also be discussed in this conference. And I personally think if the EU is to show to citizens that it is not only added value, but that it is needed, it is in the domain of medicine shortages. It's maybe also one of those existential issues where politically EU institutions can say to citizens, that is the reason why we are there, for you not to have to wait for your drug when you go to the shop.
Thank you very much indeed. That was very clear. And as you say, Minister, every new generation brings its own wisdom, and I'm very grateful, I'm sure, on behalf of everyone here to have had that contribution from this one. Thank you very much indeed. So we're going to follow up on those themes, and Minister will let you go, and then we will turn to our next esteemed speaker in a moment, because you have been sat there for a little while this morning, and energizing as this discussion was, I feel sure that there could be more energy. And so let's draw on the experience of young people. I think the best is if you go up to the lectern so that you can use the microphone there. Laura, do you want to help us re-energize this audience?
Yes, okay, so we are going to do an energizer. It's something we young people often do during conferences. So I invite you to all stand up, please. Amazing. Please also put on your biggest smile. We are not going to dance, don't worry, but I'm going to show you something to do with your hands. So we start like this, hands together. Yes. Then we put our one hand, we slide it up, like this. And then we do this together. Yeah, okay, we start from there again. 1, 2, 3. Then we go all the way down, or to the side, yes. And then, and this is the most difficult part, we switch our arms and hands. Yeah, so you go from here, you switch them. Amazing. We start from the beginning again. 1, up, 3, 4, switch. You're quite good at this. Again. 5, 6, 7, 8. 1, 2, 3, 4, 5. Then we slide back again. 6. We go up again. 7. And we close it again. Okay. Let's do it 3 times in a row. And smile, have some energy, so we are ready for the next speaker. 1, 2, 3, 4, 5, 6, 7, 8. Again. 1, 2, 3, 4, 5, 6, 7, 8. And the very last time for today. 1, 2, 3, 4, 5, 6, 7, 8. Well done.
You see now, not only do you have inspiration and wisdom from the young generation, you also have energy. Let me now turn to build on that energy by inviting the first of our esteemed speakers on the three themes of the presidency that Minister van den Broek has described. And it's a particular personal pleasure to invite Dr. Hans Kluge, who is the WHO Regional Director for Europe, to the stand. Dr. Kluge is going to address us on the first keynote speech of today on this first theme of care, and we've asked him specifically to talk about shortages in the health workforce. WHO Euro has been a forerunner in this area, Hans, I think it's fair to say. In October 2023, the 53 members of the WHO European region approved the framework for action on the health and care workforce. But these challenges can't be solved in isolation. They remain long-standing challenges for the European Union and across the whole wider European region. And we're very grateful, Dr. Kluge, to hear your insights and bring WHO's perspective to this conference. Thank you very much.
Thank you very much, Nick. And good morning, everyone, in a great, energized way. So, on the next slide, you will see the picture of Madalina Ditiu, who was a nurse at the university clinic in Bucharest at the height of the pandemic. And I'm wondering what you think when you see the picture. What I see at one hand is reminding us of the exhaustion of the health and care workforce, but at the same time, an immense resilience, strength, and determination. The health and care workforce really went beyond their limits during the pandemic, doing triple shifts, sacrificing family-wise, professionally-wise, an estimated 50,000 health and care workers unfortunately passed away during the pandemic, and all of us, like never before, relied on them to help us weathering this unprecedented threat. And as Europe is now having to weather a perma-crisis with the climate change, the AMR conflicts, terrorist attacks, all putting additional strain on the health system, this reliance will only increase. And that's why Deputy Prime Minister van den Broeke, colleagues, I'm very, very privileged to have this opportunity here to kick off this event on Europe which cares. As Nick was mentioning, I was asked to focus on the workforce, but I will be very happy during the Q&A session to provide some thoughts on the broader European Health Union. But as a medical doctor myself, the son of a doctor and a nurse, both my parents here present, this is a very important moment, because today and tomorrow, all together, we can commit to restore, to regenerate the most precious good we have, the health and care workforce, if we are really serious about a Europe which cares. In 2022, we launched our flagship report, Health and Care Workforce in Europe, Time to Act, for the first time with 53 country profiles, and we called it a ticking time bomb. Not a time bomb tomorrow, a time bomb today. And actually, it's a confluence of several crises. We have a labor force crisis, a mental health crisis, the education, gender equality, and finally, a financial investment crisis. What's the key issue here is that behind all of this crisis is a human face, is a human being. All of them studying to be a doctor, a nurse, a carer, to do a good job. And one of those faces is Sarah Abrahams, a junior doctor from the United Kingdom, which addressed 50 of our member states last year at the historical conference on the health and care workforce in Bucharest, generously hosted by Minister Alexandra Fila. And I quote here, "I am regularly looking after 2 or even 3 times the number of patients I should be, which means patient safety is being compromised. There is simply not enough time to do the bare minimum, let alone spend quality time with patients to understand their needs, nor update their loved ones. I regularly go home very late, and I nearly always feel like I have not done the best for my patients. This is so disheartening and the exact opposite of the empowering and inspiring role I thought being a doctor would be and should be. Let's now unpack briefly the different confluence of crises. First of all, there is the labor force crisis. Actually, you're facing a paradox. Europe never in its history had so many doctors and nurses. This is from our database. It's one example of the doctors, increase of 20% of the density in the pan-European region between 2012 and 2022. The same for the nurses, the same for other care workers. But of course, the needs are huge with the population aging, with the coinciding multimorbidity, and also with the good news that we have now technologies and treatments which allow people to live longer. Often is misunderstood that multimorbidity is a challenge of the elderly people. These are data from Professor Ran Balliser from Clalit Research Institute. Actually, in younger ages, there is also a huge challenge of multimorbidity, and that's why I really want to commend the Belgian EU presidency, and particularly Minister van der Broeke, to put prevention, healthy lifestyle, very high on the agenda. Because we are never be able to go back to ratios of 1:4, 1:5, so we have to activate the families, we have to activate the communities to try to stay out of the hospital as long as possible. And the aging is also hitting hard on the health and care workforce. In 13 countries in Europe, 40% of the doctors are 55 years or older. So we're expecting a tsunami of retirement in the health workers. Next crisis is on the mental health. It has been mentioned already. During the pandemic, we saw a 62% increase in absenteeism. 1 out of 2 of our precious health and care workers was reporting a burnout. And from our studies, we know that there are persistent symptoms until today of depression, anxiety, stress, which increase job dissatisfaction, lower productivity, and ultimately resignation. The third crisis is on the education. The stock of young people in the European Union is decreasing in general, and governments have to recognize that in a world where people with high skills can easily go to other sectors, they will have to compete with them, where jobs have a better work-life balance, faster career paths, better pay, and flexible working. Next one, gender equality crisis. Women make up 75% of the health and care workforce, but less than 30% are found in leadership positions, with a salary gap of 24%, which is much higher than in other sectors. Data from Denmark, UK, and Portugal report that nurses report 30% of them having had an experience of sexual harassment at a job. And data from Sweden and Estonia show that women in the health and care sector have twice as high risk of violence, while actually merely trying to do their job. These are very, very worrying data. And finally, there is the financial investment crisis. We have to commend many governments in Europe to drastically increase investment in health and health workforce during the pandemic. But what we see now, actually Minister van der Broeke was hinting to that one in the panel, is that we have to hold the fort. There's a lot of funds going to defense, to the military, cost of living. More than half of the population in the world is undergoing elections with particular considerations, and there is really competition for the funds. All of these 5 crises underpin or exacerbate one thing: inequities. Many of us know the phenomenon of medical deserts, particularly in the rural areas, becomes difficult to find a general practitioner or clinics, very tough for the farmers, among others who are unhappy and expressing frustration, but also inequities between countries. Romania, for example, is the 5th largest producer of doctors in the European Union, with doctors migrating to other EU countries. Again, I have to commend my good friend Alexander Rafilou, because the salaries are drastically increased in Romania, so tackling the issue, but also partially by attracting doctors from Moldova. So if you look at my broader pan-European region, and then if you look globally, the EU obviously is a very important magnet for health and care workforce all over the world. Now I will stop with the bad news and also go back to my nature of optimist and start the good news. Because this is a phenomenal year. It's a great opportunity. This year, WHO with its member states is reviewing the WHO Global Code on the international recruitment of health personnel. It's the 5th round of reporting. This is a phenomenal opportunity for the European Union to articulate its vision and strategy on sustainable health workforce within that major global development, which was discussed also last week at the EU-African Union Partnership Summit, where Minister Van den Broeke repeated and stressed it should not be a zero-sum game. Here, WHO can be of assistance to strengthen the data collection. I was talking to the Director of Human Resources for Health, Jim Campbell, in Geneva yesterday, who's preparing for Human Resources for Health topic at the G20. WHO is strengthening to put and to chart the flows of migration, on streamlining competencies, and also supporting countries in standardizing credentials for health education and enabling countries to acknowledge and award those digital credentials, which is the future. No solutions do exist. Either countries will continue to compete to each other, or countries will work together and collaborate around the principle of solidarity. The keywords of the high-level conference in Tallinn in December was about trust and transformation, and that's what we need. We need to instill trust, then to transform the system, and the best way to do it, as we discussed in Tallinn, was to put the health workers and the patients really up front. Last year in Astana in Kazakhstan, the 53 WHO European member states adopted a resolution on the framework for action on the health and care workforce in the WHO European region, which takes the WHO Global Health Strategy one step further. The central pillar is about retain, recruit, and reactivate, which has a lot to do with the working condition. To have flexible work arrangements, to give psychosocial care to those who do care, to protect the workers who protect us, for example, with personal protective equipment. And there, HERA, indeed, I agree with Mr. Van den Broeke, is a great, great achievement. But ultimately, to listen to the voice and the aspirations of the health and care workers, particularly the women who constitute the bulk of the workforce. And for you as health leaders to facilitate and empower more women to head hospitals, primary healthcare centers, elderly homes, and also healthcare unions. We know when the mental well-being of the health and care workers increases, it's good for everyone. Our colleague, Professor Walter Sermeus from the Catholic University of Louvain, my alma mater, doing a great research, has shown years ago already that if an overloaded nurse has one patient more, the chances for a patient 30 days after hospital admission increase with 7%, and vice versa. By every 10% increase in bachelor's degrees of nurses, the mortality decrease with 7%. Now, the message here is that it does not always have to be expensive. It does not always have to be complicated. From my own experience in the hospital, I know to provide food at night, to provide resting facilities, to have rota flexibility. I remember in the hospital I used to work, where nurses and doctors came, they could give their children to the nursery. They didn't have to think about their family. So solutions are there, but it's about leadership and a political choice. About reactivating. Our good friend, the Minister of Health of Germany, Karl Lauterbach, was reporting in EuroHealth that and I know that my other good friend, Dr. Steffen, is present here, in Germany, 300,000 full-time equivalents of health workers are working in other sectors. I mean, can you imagine? Just to reactivate a small portion of those 300,000 people. Next slide, please. The second pillar is about optimizing performance. There will be a need to transform the system because never enough we will have nurses and doctors. And again, there are many good examples. Still too much conservatism in many countries to expand the scope of practice of nurses, the biggest workforce in the region. They always say, and my other good friend Paul from the union knows this, that the best advocate for nurses is the son of a nurse, so I feel very confident to talk about this. And we have seen great examples, but also take use of artificial intelligence and digital tools to decrease the administrative load on doctors. When I was a general practitioner, a lot of administrative load. Here you see an example. I myself went to the whole north of Sweden in the region of Västerbotten. It's a region as large as Switzerland, with one person living per square kilometer, with long, long winters, even longer than Denmark, where I live. And we launched the WHO Primary Healthcare Demonstration Platform. You see, in emergency unit, they were bringing inside, while we were there, trauma patient, completely managed by nurses. And you see on the screen the doctor giving guidance in Stockholm, hundreds of kilometers away. When I talked to the governor of Västerbotten, I was asking how he pulls it off. He's spending more than 40% of his budget on health. And I say, what do the people think about it? He was telling, I am a very popular politician, he told. Because people know if they're in trouble, if they have this car accident, wherever they live, we will not leave them behind. You can imagine when I was returning on the plane, it gave a lot of food for thought. Next slide, please. Building the supply, the third pillar. Many of you may know the WHO guidelines on transformative education, which advocate for competency-based education models to foster interdisciplinary education and teamwork. Very important competencies, the digital health competencies, but also that family doctors and general nurses are recognized as specialized practitioners. Other competencies are about the climate change, the disasters, terrorist attacks, wars. I was not trained for this. How to save lives by all means, wherever you are. And I would like to commend here really all the representatives of the healthcare education sector and to commit that WHO will continue to work with you to overcome institutional barriers. Finally, pillar 4 and 5 is plan and invest. Planning needs very reliable information on the current and the future health system needs. What are the national and subnational health system goals? A good understanding of the local context, and to do it intersectory beyond health. The education sector, the finance sector, definitely the patient association, the professional organizations, and key in many countries, the private sector. Because the role of the Minister of Health in many countries is changing. Used to be the employer of health and care workforce. It's a shift from employment to a stewardship role for the Minister of Health. Because in many countries, actually, the private sector is a bigger employer now, particularly in the elderly care homes. But also, if we speak about climate change, One Health, veterinary, this is in other sectors. We launched a major flagship course last year on human resources for health, leadership and management. 16 countries already participated, 5 more this year, with the health, information and human resource units in the Ministers of Health. And finally, invest. On the invest, investing smart and targeted in health and care workforce is a very productive social and economic development investment. Already in 2016, the then United Nations Secretary General Ban Ki-moon established the High-Level Commission on Health, Employment and Economic Growth. And I see that my other good friend Mark from the OECD just came in. The OECD was part of it, with the ILO and WHO. And the report was very clear. Every dollar you invest, you get $9 out. So my dear friends, the challenge is huge. Solutions exist, but no country can tackle it alone. If we look to the history of the European Union, actually there has been a development of the health mandate over the last 60 years, which usually were given a push after a crisis. The thalidomide crisis, the infected blood transfusion crisis, the mad cow crisis, the financial crisis, and now the pandemic crisis actually is giving another huge push to take the countries together in Europe towards a sound common EU health policy. What I always have been advocating during the crisis is what I call a dual-track approach. It's for countries to manage crisis and at the same time deliver essential basic health services. And that's in our view the same for Europe. To have a Europe, yes, which prepares, but also a Europe which cares and protects. Ultimately, health system resilience will never materialize without resilience of the people and resilience of the healthcare workers. Failure to take action today, decisively and comprehensively, will have catastrophic consequences for the future of a Europe which aims to care, protects, and prevents. Thank you.
Thank you very much, Hans. Much appreciated, and thank you for that excellent presentation. We have time now, a bit of time, for some Q&A with the audience. Probably have about 10 minutes for that. There will be some microphones available for you to be able to ask questions to Hans. Please just put your hands up in the air. While you're thinking of the questions that you would like to ask, Hans, I'm going to take advantage of being here and ask the first question, just while everyone's thinking about the issues that they would like to ask. So this is a conference on the Belgian presidency of the European Union, and you have this broader mandate of the whole of the European region. When we talk about the European Health Union, this combination of science and solidarity and European action within the EU, how do you see that relating to your mandate and the broader role of the WHO European region?
Thank you, Nick. And that's a huge question, a very important question, which obviously we're working on day by day. But here I really would like to express, first and foremost, appreciation to the Commissioner Stella Kyriakides, who I know will join us later, because I think this relationship between the Regional Office for Europe and the Commission has been growing really a lot, because there's a lot of synergy that we see. Actually, Minister van der Broeke was hinting at it, at the commercial terms of health. I mean, by definition, by nature, there will be, at least for the foreseeable future, being some tension between the internal free market and the public health goals. Our mandate is very clear. Health for all, for everyone, no matter where you come from, including migrants and refugees, is number one. Number two, as you told yourself, Nick, we have the pan-European geographical mandate. As we saw, EU will never be safe without its neighbors. Western Balkan, Ukraine, eastern part of Central Asia, of the region, speaking about polio. I mean, we don't talk about this, but we should be proud that we kept the polio-free status, because from Afghanistan to Tajikistan, next is 2, right? We had it in 3 countries. And then we have, of course, the unique partnership with the European Observatory, where I want to commend also Director Josep Figueras. I think that's analyzing the trends. We are helping countries with policy. And to give an example, 22 April, we're going to launch in London with the Chief Executive of the UK National Health Security, Dame Jenny Harris, the Pan-European Network of Disease Control, which was one of the main recommendations of the Monti report, because there is the ECDC, but that's for 27 countries. But we have to look at the pan-European continent. How do we foster policy coherence next time? What about the surveillance, the exchange? We didn't have a platform to bring together the 53 pan-European member states, which now we will have with the leading public health institution. And maybe a last one is to explore, because I'm accompanied by Director Natasha Muscat, is we have the WHO Barcelona office, which you know, Nick, where we have the health financing, which could give a major contribution, for example, to the European semester.
Thank you very much indeed. You've identified a whole range, I think, there, and just illustrated the degree of connections between a European Union set of focuses and priorities and the wider role of the WHO European region. Thank you for doing that. I can see a question. I can see several questions. Excellent. Gentleman at the back there. Thank you.
Yes, thank you very much. Thank you, Dr. Kluge. My name is Adam Ogalewski. I represent European Federation of Public Service Unions, and we represent healthcare workers from Iceland to Kazakhstan. So I would like to thank you for your work and support for WHO. I'm on a daily basis meet with our affiliates, for instance, also in Romania, in the UK, and they're always telling me this is the excellent piece of work that WHO is doing, but we need to really ensure that that is being implemented on the national basis, and therefore we need to support our ministers. My questions are two. In relation to what you really identified is about the gender issues in the healthcare workers, because this is where the nurses are predominantly women, and I think the issues about the work-life balance to ensure that women could deal with their daily issues. And another point, which is also very important for us, is about the violence. We know that the violence increases across also EU. We have the campaign in Finland to change the criminal law. The violence is even higher in the Central Asian regions. I'm very often with the contact with our nurses and doctors in Kazakhstan. So my question is to you how you will be able to do it, because I think it's important work that you are doing on the gender equality and violence. And one last point, we are colleagues from HOSPIM here with employers organizations. We are now trying to negotiate on the third-party violence agreement with employers in order to protect healthcare workers from the violence. Thank you.
Thank you. So important issues of both gender issues and violence in relation to healthcare workers.
First and foremost, thank you very much for your pan-European reach, and you mentioned Central Asia, which for me is my top geopolitical priority, because I'm looking obviously at the inequities across the whole region. Yes, I was in Kyrgyzstan lately, and it was heartbreaking. I always meet, like here, the young people up front, and we had the young doctors and nurses and students, and they were telling how they're being attacked physically while having very, very few protection. Of course, there we engage a lot with in those countries with the leadership, and that's why it's so important to keep health at the top of the political agenda and keep engagements, not only with prime ministers, with the presidents, but also with the parliament. Maybe a positive example, if we speak about the gender, is that I have to give a lot of credit to other colleague who accompanies me, the region advisor, Dr. Thomas Zapata, who created the pan-European network of government chief nurses and midwives, who are regularly meeting each 2 months, also the colleague Maggie Langins, and advocating, for example, first and foremost for governments to have a government chief nursing officer, because we still don't have in all countries. But we all have to pull together on the issues of the violence. You see that our WHO Director General, Dr. Tedros, also is very, very vocal on social media on that one. I mean, that is very clearly, be it individual violence or attacks on healthcare, that's a breach of international humanitarian law and absolutely a red line.
How much difference how much does it matter, Hans? You were talking about reactivation and keeping people within the workforce. When we talk about these issues of gender and of violence, it sounds as though it's critical to being able to sort of make the difference between people wanting to stay in the health workforce or maybe return to it who have left.
What doctors and nurses, and I want to say, we don't only, I mentioned not doctors and nurses, but obviously we're talking about the whole health and care workforce, including informal carers, which become more and more important with the aging of our population. What colleagues are telling me, Nick, is that they want to do a good job. You know, like Sarah was telling, if you have the feeling that you're disempowered and you work day and night and you have to go home and you felt that you left your patient, you know, behind, this is the biggest demotivating factor, and we have to tackle that one.
Thank you. Other questions? I see a question over there. Yes, please.
Good morning. Thank you very much. I'm Raymond van Holder. I'm representing European Kidney Health Alliance. I think you were very correct, and it is very important to point out inequity. And inequity you mentioned among countries and social classes, but my question is about inequity among diseases, because kidney care, for instance, that's something that's often forgotten, although it's the most frequent chronic disease, it's the most expensive one, it's the most polluting treatment with dialysis. It's also in crisis logistically very difficult. So why is the focus quite often on other diseases, which is very much correct, but I think this is a problem that should be looked at very carefully and very urgently. Thank you.
I was going to say, I'm going to take, because I know there are 2 or 3 questions, so if you would like to pass that microphone through to this lady just there, and I believe there's one on that side as well. Yes. Would you, if you would like to ask your question, then I'll come to you, and then I'm afraid that's going to have to be it for this round. Thank you.
Thank you very much, Nick. First of all, I want to say thank you, Dr. Kluge, and also to the previous panel, which was amazing. My question is a question and a comment about something that you mentioned, the commercial determinants of health. My name is Florence Bertoletti. I'm kind of well known for having fought the Tobacco Products Directive, and the only reason why we were able to do that is because we were supported financially to do legislative proposal, to work on the legislative proposal. On page 36 of this amazing document, there's all the legislative proposals that have been cancelled or disappeared from the Beating Cancer Plan. And yet, all the finance mechanism that has gone to the NGOs is for project and not for NGOs who have the know-how on how to work on legislative proposals. And I didn't think I would have the courage, but the Commission needs to listen to us. We need operating grants, otherwise we're all going to die to do projects that are not equipped. So can our voice be heard? It's not only for my organization. Most of our organization did not get our funding. Some of us are going to die. And without us fighting the commercial determinants of health, there's 25,000 lobbyists who block, amend, and delay legislative proposal. We need to be supported.
Thank you. And clearly an important issue, although, of course, Hans is not from the European Commission. But
yeah. Thank you, Hans. So I'm Jérôme Weinbach, head of the French delegation. Thank you for your very convincing presentation for a framework for action on workforce in the health and care sector. Maybe there is one dimension we should also discuss in this work plan and framework. This is the external dimension and how to avoid also competition, unequal competition in attracting human resources. fine, this is good for the region, Europe region, to work on your plan, but how could we together avoid attracting or, I would say, stealing resources from the poorest countries, because this is something which is already in progress, and we have to also consider a good balance in our actions. Thank you.
Thank you, colleagues. So, the specific case of particular diseases, in particular kidney disease, the situation of NGOs, and migration and how to address unfair migration. A little set for you, Hans.
Thank you. All awesome questions. On the first one, we are working on a new vision on non-communicable diseases in the run-up to the UN high-level meeting in 2025 in New York. It's called the 100-week challenge, and we can say something more about that one. But the principle, of course, is that we leave no one behind. We have not a disease-specific approach in WHO, right? It's under the banner, but definitely we do put a lot of attention on that one. Even yesterday, we had the meeting with all the chairs and the co-chairs of the working groups of what used to be the Oslo Medicines Initiative and now the National Medicines Platform, particularly on equitable access, sustainable access to high-priced innovative medicines. And one of the very good colleagues who was there was Ian Lecam, who indeed also was putting this rightly forward, and we are very, very feverishly on that one. 3 and 4 July in Copenhagen, we will have the National Medicines Platform with the CEOs of the big pharma member states, patients and insurers to look what are the 2-3 innovative proposals that can be implemented together with the European Commission and the OECD. On tobacco, I mean, tobacco clearly is still worldwide the single biggest killer. And we encourage, of course, very much any legislation in that regard. Same for alcohol. We do have enough data now that this discussion of harmful and non-harmful is fake. There is no norm. I mean, every drop of alcohol is toxic and increases breast cancer in women. So I myself made already an unpopular decision, which becomes a bit more popular now. Often in life it's a matter of habit, is that at any WHO meeting we don't serve alcohol anymore. And that actually, thank you. Although I'm still being invited to by companies, and that's where WHO can really have a very big comparative advantage, and there will be sessions also on that matter. And finally, mon cher ami, indeed, to avoid competition, so the WHO Global Code Review is a big one. Part of it is looking at which kind of bilateral, trilateral agreements, including on circular mobility, have been working and which ones not. And to give the positive example is Ireland. Ireland has an amazing strategy adopted to become much more self-sustainable. So I think we have to look at those elements as well. Thank you.
Thank you very much indeed. Hans, thank you very much for the questions. I think the breadth and scope of the questions, Hans, reflects the breadth of your responsibilities, but for sake of time, we have to stop there. We are now going to break for a short coffee break for about 20 minutes. So the coffee is just right outside, and there will be stands that you can also explore during the coffee break, which you saw on the way in. We will come back here at 10:55 for our next 2 plenary speakers. But before you leave, I would like you to join me in thanking our excellent speakers this morning, Minister van den Broeke, Beatrice Chiobou, Laura van der Straten, and Regional Director Dr. Hans Kluge. Thank you very much. See you in 20 minutes.